Sjogren syndrome is a chronic systemic autoimmune disorder that affects the salivary and lacrimal glands, causing xerostomia and xerophthalmia. The female to male ratio of this disease is 9:1. Lymphocytic infiltration of glands causes SNR destruction that results in hypofunctioning of these glands. The effects on eye are called keratoconjunctivitis sicca, where sicca means dry. Clinical presentation of both xerostomia and xerophthalmia is called the sicca syndrome. The two recognized forms are primary Sjogren syndrome or the sicca syndrome that affects lacrimal and salivary glands without any connective tissue disorder. While the second form is secondary Sjogren syndrome, patient manifests sicca syndrome in addition to autoimmune connective tissue disorders, among which rheumatoid arthritis is the most common type. While the second most common connective tissue disorder associated with Sjogren syndrome is systemic lupus erythematosus, also known as SLE. The clinical presentations include diffuse firm enlargement of major salivary glands along with xerostomia, that is dryness in mouth causing scanty frothy saliva and difficulty swallowing and wearing dentures. There is atrophy of the papilla that results in altered taste and increased chance of secondary candidiasis along with a fissured cobblestone appearance of the tongue and increased chance of dental caries along with cervical caries, that is due to decreased saliva production. Histopathology includes central destruction of SNI and foci of lymphocytes surrounding these SNI. Focus is an aggregate of 50 or more lymphocytes. Although SNI are destroyed but ductal epithelium persists, these persisting ductal cells and surrounding myoepithelial cells become hyperplastic, form characteristic epimyoepithelial islands as the one being showed here. Among many of the diagnostic tests, the ocular tests include Schirmer's test, where a sterile strip is placed between lower eyelid and the eye and a value of less than 5 mm in 5 minutes is considered diagnostic. Whereas in the Rose Bengal test, the purple staining of the whites of the eye can be considered a sign of Sjogren syndrome. The salivary test includes xylography, where diffuse xylactasia that shows punctate destructive patterns and a characteristic fruit-laden branchless tree pattern is viewed. Whereas in the scintigraphy, a decreased uptake of technetium-99, which is a radioisotope, is seen. The immunohistochemistry report shows that the patient is positive for immunoglobulin G, an increased value of ESR, a positive RF factor, a positive anti-nuclear antibody titer, anti-Rho SSA antibodies are being positive, and anti-La SSB antibodies are also positive in the patient. One of the last diagnostic tests is minor salivary gland biopsy, where 5 to 6 ducts of minor salivary gland are taken from the lower lip. While treatment of Sjogren syndrome is mainly symptomatic, for symptomatic relief of dry eyes and dry mouth, artificial tears and salivary analogues are used. If any functional salivary tissues are present, salivary stimulants like pilocarpine may be helpful. Oral hygiene management and caries prevention by fluoride application is quite necessary. Follow-up and good look at new symptoms is necessary, as there are 5 to 15% chances of developing lymphoma, also known as maltoma, which is a low-grade non-Hodgkin B-cell lymphoma, especially in patients with primary Sjogren syndrome.